American Cancer Society estimated roughly 2 million Americans would be diagnosed with cancer last year. And in that time, more than 609,000 people would die of the disease.
More than 13,000 women are diagnosed with cervical cancer each year, but rates are dropping, and that is thanks to early detection and regular screening.
Hey everyone, and welcome back to the channel. Today, we're diving into something incredibly important, something that often flies under the radar when we talk about fighting cancer: prevention and early screening. You might think that new treatments are the main reason we're making progress against this disease, and while they're definitely crucial, you might be surprised to learn just how much of an impact simply being proactive can have. In fact, a massive study looked at 5 major cancers over 45 years, and the results are truly eye-opening. Stick around, because we're about to break down how prevention and screening have been absolute game changers in saving millions of lives. The big picture. So, this landmark study from the National Cancer Institute looked at breast, cervical, colorectal, lung, and prostate cancers. And get this, between 1975 and 2020, a staggering 5.94 million deaths were averted from these cancers. That's an incredible number of lives saved. But here's the real kicker. A whopping 80% of those averted deaths were thanks to prevention efforts and early detection through screening. That's right. Things like quitting smoking, getting your regular checkups, and knowing your risks have had a bigger impact overall than even the amazing advancements in treatment. As Dr. Katrina Goddard from the NCI put it, the contribution of prevention and screening to reducing mortality is surprisingly high. Let's take a closer look at each of these cancers. The 5 success stories. Lung cancer. Emphasize smoking cessation. For lung cancer, the impact of prevention, specifically stopping smoking, is absolutely massive. It accounts for a jaw-dropping 98% of the 345 million averted deaths. Screening with low-dose CT scans for high-risk individuals is also important, but the real victory here is in tobacco control. Survival rates are improving, but avoiding smoking remains the #1 way to beat this. Cervical cancer. Cervical cancer is a true success story for screening, which accounts for 100% of the 160,000 averted deaths. Regular Pap tests and HPV tests can actually catch precancerous changes before they become cancer. Plus, the HPV vaccine is a powerful prevention tool for the next generation. Survival rates are good when caught early, so regular screening is key. Colorectal cancer. Focus on polyp removal during screening. We've seen 940,000 deaths averted from colorectal cancer, and 79% of that is thanks to screening. Tests like colonoscopies can not only detect cancer early, but also remove precancerous polyps, preventing the disease altogether. Diet, exercise, and limiting red meat also play a role in prevention. Early screening, now recommended starting at age 45 for most, is crucial. Breast cancer. Acknowledge treatment but highlight screening's role. For breast cancer, the main driver of the 1 million averted deaths has been treatment advances, 75%, but mammography screening, 25%, has also played a significant role in catching cancers earlier. Knowing your risk factors, maintaining a healthy lifestyle, and following screening guidelines are all important. Survival rates have improved dramatically, especially for early-stage disease. Prostate cancer. In prostate cancer, screening PSA testing has contributed to 56% of the 300 deaths, with treatment advancements making up the rest. However, PSA testing is complex, and the decision to screen should be made with your doctor after discussing the potential benefits and risks. While survival rates are very high overall, understanding your individual risk is important. The bigger takeaway and disparities. So, what's the main message here? Prevention and screening are incredibly powerful tools in the fight against cancer. They might not always grab the headlines like a new breakthrough drug, but their impact on saving lives is undeniable. However, we also need to talk about a critical issue: health equity. The benefits of prevention and screening are not reaching everyone equally. We see significant disparities in screening rates and cancer outcomes for racial and ethnic minorities and underserved communities. This is unacceptable, and we need to work harder to ensure that everyone has access to these life-saving measures. Factors like access to healthcare, insurance, and even just having reliable information can make a huge difference. What you can do. Now, what can you do with this information? Know your risks. Understand your family history and lifestyle factors that might increase your risk for different cancers. Talk to your doctor. Discuss the recommended screenings for your age and risk level, and make a plan. Make healthy choices. Incorporate regular physical activity, a balanced diet, and avoid smoking and excessive alcohol. Spread the word. Share this information with your loved ones and encourage them to be proactive about their health. Support organizations. Consider supporting cancer research and organizations working to improve access to prevention and screening. The progress we've made against cancer, thanks to prevention and screening, is truly inspiring. By taking proactive steps, we can continue to drive down mortality rates and save even more lives. Remember, early detection can make all the difference. Thanks for watching. If you found this video helpful, please like it, share it, and subscribe for more health-related content. What are your thoughts on this topic? Let us know in the comments below. We'll see you in the next video.